Wow, welcome to the journey of upper and lower blepharoplasty together. And I have many videos, but I was just told by a very nice patient of mine that I don't have one on the transconjunctival approach for the lower eyelid blepharoplasty. And it's important to have that video because that's primarily what I do now, as opposed to the subciliary approach. So I want to follow this nice lady and see how it goes. So let's show you. Very good. Okay. So you can see the beautiful smile and and you can see the excess skin that's making it difficult for the eyes to look wide and open. So we want to remove the skin from the upper eyelid. And the upper eyelid is primarily a skin issue. And as you can see, I'm going to show you gently right here. Mostly a lot of extra skin, but in the medial aspect, medial is close to the nose. Lateral is far out. In the medial aspect, there are fat pockets. Let me show you. I want you to close your eye, please. And I'm going to gently push on the globe. You see that? There you go. That is a fat pocket. Good. Same on this eye as well. See that bulge? Little grape sitting there? That's it. So only in the medial aspect. Now for the lower eyelid, there's not a lot of extra skin, and we have to be very careful in removing any skin in this area because that can pull the eyelid down and cause ectropion. So what we do is we remove the fatty bags from inside the eyelid right there, and we'll show that today. And once we remove it from the inside, then this becomes smoother, flatter, no bulge. And for this crepe-like skin, we use laser. I use resurfx laser to smoothen it out. And this way we avoid the complication of pulling the eyelid down. So let's demonstrate that today. And for terminology, upper blepharoplasty with excision of medial nasal fat pad, and lower transconjunctival blepharoplasty. Lower blepharoplasty with transconjunctival approach from the inside. There we go. Let's start. And I want to thank this lovely lady for allowing me to use it. That's very kind of her. Okay, so let's start with the marking first. We need markings in the upper eyelid. In the lower eyelid, there is no incision, so we won't be making any markings. If I was going to take a small pinch of skin off in the lower eyelid, then I would mark a tiny bit of area. So for now, just the upper eyelid, and let's see how we do it. That's the patient's natural crease right there. So we try to go into the natural crease right there. Typically it is about 8 millimeters roughly in most individuals. Let's take a look. There we go, 8. Now we just follow the curve. And then we gently pinch to see how much we can safely remove. So when the eyelashes curl up, that's the right amount. You can see it's going sideways right here, going further back here. Good. Now we'll do the medial part as well. Now we can just combine these. Now we pinch again to make sure it's not too much. Oh, looks good. Looks good. Looks good. Looks good. And good. There we go. So the injections are done in the upper eyelids. If you take a closer look, both sides are injected. This is the entry point with a blunt cannula. And we have done infraorbital nerve blocks and local injection, and we should be good. finished the upper eyelid and the lower eyelid blepharoplasty. So let's show you what we have accomplished. So as you can see, upper eyelid is done. The extra skin has been removed, and we'll show you that in a second. And fat removed as well. There's no incision line anywhere, and the fat removed from here as well. So now let's show you the amount of fat removed.
Who knew I was so fat?
So there we are. So we have the medial fat pads of the upper eyelid, medial fat pads of the lower eyelid, central fat pads, and the lateral fat pads. And we're all done. Oh, skin. Sorry, forgot to show you the skin. So the skin is right here. Good. Excellent. So here we are, as you can see, the fat and the skin has been removed, and can you see? I'm going to show you exactly. So we can see now the fat pads and the skin. There we go. And here. Here. And you can see that the eyes are closed, which means we have not removed excess skin. Eyelid closure is still intact. So we are all done, and looks great. Okay, so we are done now, but we have to do resurfx laser of the lower eyelids to tighten the skin a little. This is the perfect time because local anesthesia is working, and we can do it without any discomfort. Let's do it, and I'll show you. Okay, so you can see the laser is done, and now the most important thing for the next 2 days, not 2 days, but just today and tomorrow, is resting the eyes, which means you cannot open the eyes unless you have to go to the bathroom or you have to eat. So keep your eyes closed and rest them. Use a lot of icing. The first 2-3 days are critical. And along with that, make sure the head is elevated if possible. And that's it. After the first 2 days, then you are in pretty much good shape to open your eyes and use them for normal daily activities, but nothing excessive. Absolutely nothing that can make you bleed, like NSAIDs, which are Motrin, Aleve, Excedrin, ibuprofen, all those. No fish oil or strange supplements, and no alcohol, and no heavy exercise. 2 weeks, very critical, or you can bleed inside the eye, and rarely you can lose vision as well. So please be very careful. Very good. And the nice lady will be sending us photographs every day. We'll show you day-to-day progression. Fantastic. So we are post-op day number 6, and the lovely lady's here. I'm so happy there's no makeup on right now. If she wanted to use cover-up, she could use cover-up today after the stitches come out, and she could go out. And nobody would have any idea after the cover-up because you can hide it really well. The left side has bruised more than right, no specific reason, but this is all done. Let's take out the stitches and we'll keep you posted on this journey. Here's a beauty queen again, 1 month post-op without a stitch of makeup, and look at the eyes looking so good. Very happy, great progress, and we are going to keep you posted. Look at this. Very nice, great. There we are. So at this stage, she can put on makeup and go dancing if she wants to, but she can't. She's got a bad foot, so we'll wait and see.
Yeah, broken into places.
Yes, I'm so sorry. We'll do another follow-up 2 months from now. That will be the final follow-up, 3 months post-op. And then we'll update at that time.